This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Friday, March 12th. Welcome to Africa 54. We continue to work remotely due to the COVID-19 pandemic. But what hasn't changed is our commitment to bringing you the latest and most important news from the African continent and around the world. This is today's Africa 54. The White House is calling for a full, independent investigation into human rights abuses in the conflict in Ethiopia's Tigray region. The ongoing violence in Tigray has left 3 million people in need of food assistance. VOA senior diplomatic correspondent Cindy Sain has our report.
In Ethiopia's mountainous Tigray region, federal troops have been fighting forces of the region's former ruling party, the Tigray People's Liberation Front, in the north since last November. Thousands of people have been internally displaced, sought refuge in neighboring countries, and killed. A recent Amnesty International report concluded that Eritrean soldiers killed hundreds of civilians in Ethiopia's ancient town of Axum in November in what the rights group called a massacre. Another rights group, Human Rights Watch, later corroborated the mass killings of civilians with additional reporting and research. White House Press Secretary Jen Psaki told VOA the United States wants a full and independent investigation into human rights abuses in the Tigray region.
So the president is deeply concerned, highly engaged on this issue.
Secretary of State Antony Blinken told a congressional panel Wednesday the situation in Tigray is unacceptable and must change.
We have, as you know, forces from Eritrea that are there, and we have forces from an adjoining region, Amara, that are there. They need to come out, and a force that will not abuse the human rights of the people of Tigray or commit acts of ethnic cleansing, which we've seen in western Tigray, that has to stop.
The United Nations says 3 million Tigrayans are now dependent on food assistance because the conflict interrupted the harvest. Rights groups say humanitarian access to rural parts of the Tigray region has been limited. But the Ethiopian government argues that access is a sovereignty and a security issue, and UN teams are not free to go wherever they please.
This country is not no man's land. It has a government. It only has difficulty in the north. So they were told in some of areas they were not supposed to move. But they indulged themselves to kind of adventurous expedition.
The U.S. ambassador to the United Nations, Linda Thomas-Greenfield, said the hunger crisis is man-made, adding she used that gender designation deliberately.
We call on all sides, and I stress all sides, to stop the fighting and allow this man-made humanitarian situation to be addressed.
Secretary Blinken said Ethiopia's Prime Minister Abiy Ahmed was an inspiring leader who was awarded the Nobel Peace Prize. But now he needs to step up to make sure his own people who are suffering are getting the protection they need and deserve. Cindy Sain, VOA News, Washington.
Gunmen in the northwest Nigerian state of Kaduna kidnapped around 30 students overnight from a forestry college near a military academy, according to the state security commissioner. This is the fourth mass school abduction since December. The Federal College of Forestry Mechanization sits on the outskirts of Kaduna City, capital of Kaduna State, in a region where banditry has festered for years. Kaduna State Security Commissioner said an unarmed gun attacked the college at around 11:30 p.m. local time on Thursday. He said the army rescued 180 people in the early hours of Friday, but about 30 students, a mix of males and females, are yet to be accounted for. Staying in Nigeria, where authorities are clamping down on those who flout rules aimed at curbing the spread of coronavirus with mobile courts, which can be dismantled and moved at the end of each day. Emma McCarthy reports.
Eagles Square in Nigeria's capital Abuja usually hosts concerts, rallies and even presidential inaugurations. But since the onset of the global health crisis, it has a new role: punishing those who break the rules. It's the site for one of several pop-up courts that are being deployed across the country. They can be dismantled each day and moved to new locations. Unemployed graduate Martin Uka is one of those brought by police to appear before a judge for breaking rules such as mask wearing, social distancing and limiting gatherings.
I was actually sitting and waiting for a job interview, where they came in to arrest me. So I never knew they were up to this. If not, I was having my face mask on me.
He and several dozen others are fined 3,000 naira, or nearly $8, with an option of community service. They are arguably lucky. Under the law, they could be jailed for up to 6 months. Uka says he will be careful in the future.
I don't really feel bad. I know I'm paying for my sins, actually.
Rights groups have warned that arbitrary enforcement of the rules could lead to rights abuses. But the government is adamant that there should be no let-up on the rules, even as it rolls out vaccines. Africa's most populous nation started vaccinations last week after receiving nearly 4 million doses through the World Health Organization's COVAX scheme.
That was Emma McCarthy of Reuters reporting. The COVID-19 pandemic has increased the marginalization of vulnerable groups like persons with disabilities in Nigeria. Disabled people account for 1/3 of those living in extreme poverty, leaving aid groups scrambling to help those in need during the pandemic. Timothy Obiezu reports from Abuja.
Physically challenged Nigerian Salamatu Abubakar has 4 children, with another on the way. Without her sight and a source of income, Abubakar has trouble getting by, sometimes begging to survive. She says the coronavirus pandemic has exacerbated this challenge.
Since the pandemic, we've suffered to feed our children. We don't have any money. We had to stop our children from going to school.
Some 27 million Nigerians live with disabilities and constitute 1/3 of the country's poorest. This Abuja community for the disabled includes 600 people, most of whom depend in some way on support from aid groups. Community Secretary Mohammed Dantani says even that is hard to come by these days.
Before, if not 2 days, 3 days, you see somebody. But now we take like 3 to 1 week, 4 weeks before you see some assistance to the community.
To cope, some women here are taking on the pandemic with a savings cooperative plan they started last August. Women like Abubakar have benefited from the scheme.
I'm very happy with this contribution. One time my child was sick, they gave me about $14. I used the money to take my child to the hospital.
Advocates say the pandemic has further marginalized disabled persons.
In the issue of the information dissemination, there are a lot of programs around sensitizing people, but the question that one needs to ask, how inclusive are the programs is? Do we have sign language interpreters?
Advocates are calling for the commission to become more active to ensure people like Abubakar are getting the support they desperately need. Timothy Obiezu for VOA News, Abuja.
A Tanzanian diplomat has dismissed reports that the East African country's president, John Magufuli, is in hospital in a critical condition with COVID-19. Tanzanian opposition leader Tundu Lissu has cited medical and security sources for information that the president was flown to a private Nairobi hospital in neighboring Kenya and then on to India in a coma. However, the Namibian Broadcasting Corporation quoted Tanzania's ambassador in Windhoek, Modestus Kipilimba, saying Magufuli was in good health and remained in Tanzania. Magufuli, 61, who is Africa's most prominent coronavirus skeptic, has not been seen in public since February 27. Doctors in Zimbabwe say they are worried about the slow pace of the country's COVID-19 vaccination program for frontline health workers. As Columbus Mabunga reports from Harare, there are a number of reasons why people are not rushing to get vaccinated.
As of Thursday, fewer than 36,000 people had received shots in the first phase of Zimbabwe's campaign to vaccinate frontline workers like doctors and nurses against COVID-19. Zimbabwe received a donation of 200,000 vaccine doses from the Chinese company Sinopharm in February. But Dr. Johannes Marisa says health workers are skeptical of the Sinopharm vaccine, which is in the final stages of testing.
They are concerned that probably they may develop some unknown side effects if the drug is still in stage 3 of in phase 3 of the clinical trials. So that's one thing that is of great concern.
Some health workers who hesitated at first have changed their minds and gotten inoculated with the Sinopharm vaccine, which Zimbabwe's government says has an efficacy rate of between 76 and 86%.
I decided today to come and get a shot and do my part to protect myself and to protect other people from contracting and spreading the COVID-19 virus.
Still, a survey by Zimbabwe's College of Public Health Physicians says 49% of Zimbabweans do not trust that President Emmerson Mnangagwa's government will provide them with a safe and effective coronavirus vaccine. The country's Association of Doctors for Human Rights says that partly explains the low acceptance of the Sinopharm vaccine by health workers.
We need the Minister of Health to have an effective communication department so that people are given the information regarding this vaccine, about its safety, about its effectiveness, and dispel all those myths and misconceptions which are surrounding these vaccines.
The government says the vaccination program is well on course and says it expects to receive more vaccine doses from abroad.
Progress has been registered in receiving the second donation of 200,000 doses of the Sinopharm vaccine from China, a donation of 75,000 doses of the inactivated Covaxin from India, and another donation of 20,000 doses of Sputnik V vaccine from Russia.
Zimbabwe's government plans to immunize 60% of the country's estimated 14 million people in hopes of achieving herd immunity by end of the year. Columbus Mavunga for VOA News, Harare, Zimbabwe.
In his first primetime address Thursday night, President Joe Biden marked 1 year since widespread pandemic shutdowns began across the United States and asked Americans to help with the challenges ahead. White House correspondent Patsy Widakuswara has this report.
It has been a year since the World Health Organization declared COVID-19 as a global pandemic. Since then, more than 2.6 million people have died around the world, 530,000 of them in the United States.
We all lost something, a collective suffering, a collective sacrifice, a year filled with the loss of life and the loss of living for all of us.
In his first primetime address Thursday, on the 50th day of his term, President Joe Biden outlined the steps his administration is taking to defeat the virus, including exceeding his own target of 100 vaccine shots in his first 100 days.
We're actually on track to reach this goal of 100 million shots in arms on my 60th day in office. No other country in the world has done this.
Biden said he is directing all states to make all American adults eligible to get the vaccine by the 1st of May. But he is facing a number of challenges, including vaccine hesitancy among some Americans and state governments ignoring federal health protocol guidelines, including Texas, which recently lifted its mask mandate.
A mask, the easiest thing to do to save lives. Sometimes it divides us. States pit it against one another instead of working with each other.
Analysts say divided views on vaccines and health protocols have been caused by politicization, particularly during the early days of the pandemic.
People have been getting such mixed messages about public health, and the climate has been so polarized that there is a really distressing lack of public faith in science, in public health messaging. It's really understandable given the mixed messages that people have heard, but I think it's one of the lasting harms that's been done.
Earlier Thursday, Biden signed a $1.9 trillion coronavirus relief bill into law. The stimulus package was passed by Congress without Republican support.
This isn't a rescue bill. It isn't a relief bill. It's a laundry list of left-wing priorities that predate the pandemic.
Biden will travel the country next week to tout the law bringing COVID-19 relief in what his administration calls the Help is Here tour. Patsy Widakuswara, VOA News.
Coming up, the growing popularity of specialty teas in Kenya and why it matters to farmers. We'll be right back. Welcome back to Africa 54. Abortion is illegal in Malawi unless the mother's life is at risk. However, that doesn't stop an estimated 140,000 women per year having unsafe terminations. That leave 20,000 women dead and countless others permanently scarred. Efforts to liberalize current abortion laws to prevent deaths are facing resistance from conservative groups. Lamek Masina reports from Blantyre.
After getting pregnant at age 17, Melita, not her real name, saw abortion as her only option to stay in school. But Malawi's 160-year-old abortion law only allows termination to save the life of a mother. So Melita went to a witch doctor.
A few hours after taking the concoction of herbs, I started bleeding heavily. The pain I felt around my cervix was unbearable, and I started crying while rolling on the floor.
Though she can no longer have children, Melita was lucky.
Because I've been hearing stories of women dying from backstreet abortions. So after experiencing persistent abdominal pain and bleeding, I was very scared that I would also die.
Research by the US-based Guttmacher Institute and the Malawi College of Medicine shows 140,000 Malawian women have an unsafe abortion each year that leave 12,000 of them dead. Countless survivors like Melita are permanently scarred. Campaigners have since 2015 been pushing a bill on expanding legal abortions to cases of rape, incest, fetal deformity, and threats to health.
There are additional 3 grounds that are there. When enacted, the new law will allow women who face physical and mental dangers to their lives to access abortion.
But protests in 2016 from conservative and religious groups who call any abortion murder delayed debate on the bill.
God blesses you in your womb. And the Bible also tells us in Jeremiah chapter 20 that thank God that the womb of my mother was not my grave. If somebody dies before they are born, it is like the womb was their grave.
Malawi's lawmakers are expected to finally debate the bill before the current parliamentary session end on March 26. Lamek Masina for VOA News, Blantyre.
A rapidly growing base of consumers in Kenya is flocking to specialty teas, which the government says could cushion farmers from low prices for black tea, one of the country's main exports. Shara Lee has more.
On a farm in central Kenya, a group of guests pick purple tea leaves. They've travelled from Nairobi, part of a tea tour that launched last October. It's a sign of how a rapidly growing base of consumers, like Bella Guarda, are flocking to the health benefits of specialty teas.
It's palatable, like you don't even need to add sugar, it's easily digestible, it's milder than black tea, and it's just an experience.
Kenya is the world's biggest exporter of black tea, and the crop is one of the East African nation's top hard currency earners. The government says new varieties could cushion farmers from oversupply of black tea and low prices. Karanja Kinyanjui is a purple tea pioneer. His farm, which runs the Gatura Greens Tour, started growing the crop in 2009.
Purple tea is twice the price of green tea. When we are buying from the farmers, we buy it at 100 shillings, while normally they get 50 shillings for the same kilogram of tea. And when we process ourselves, we sell this one double the price of the green tea.
Experts such as Samson Kamanya of the Kenya Tea Research Institute say substances in the purple pigment have several health benefits.
Very strong anti-inflammatory effects, antimicrobial, anti-aging.
The tea is also produced in China and Japan. And Kinyanjui has 20 acres of the purple variety alongside 100 acres of the usual leaves. The farm processes its own purple tea, which is sold directly to Chinese buyers. The business also has clients in Canada, Sweden, the United Kingdom and the United States.
Shirley of Reuters with that report. Muslims voted in record numbers in the 2020 presidential election, with well over 60% casting their votes for now President Joe Biden. Some now wish to see more Muslims in the White House. VOA's Eunice Salim spoke to some American Muslims in this report narrated by Nova Pawadi.
The Biden administration has been touted as the most diverse cabinet in U.S. history. This and President Joe Biden's reversal of the travel restrictions mostly affecting Muslim-majority nations has earned praise from Muslim advocacy groups. But some wish the president had gone further.
What we're looking for President Biden to do and to work with the Muslim community is certainly more inclusion, more appointment in his administration, utilize the talented, energetic, well-experienced American Muslims to be in his administration.
The U.S. Constitution forbids selection or disqualification from public office based on someone's religious background. But this representation matters to many Muslims, including Abrar Omesh, a Libyan-American in Fairfax, in the U.S. state of Virginia.
I will be honest, I was hoping to see a little bit more, not just in terms of individuals and leadership, but you know, he currently is proud to have the most diverse cabinet that we've ever seen in the country's history, but there's not a single person representing the Muslim community.
Muslims have been appointed to lower-level positions, including Pakistani-American Ali Zaidi as First Deputy White House National Climate Advisor, Bangladeshi-American Zain Siddiq as Senior Advisor to the White House Deputy Chief of Staff, and Palestinian-American Rima Dodin as Deputy Director of the White House Office of Legislative Affairs. Muslim advocacy groups have compiled and submitted a list of qualified Muslim Americans to the Biden administration for consideration of future posts.
We have a lot of doctors, we have a lot of health care takers that we can contribute to bringing America back to a healthy America, to a stronger economically America. And so we're looking forward to work with the Biden administration.
While the executive branch still does not have a senior-level Muslim cabinet member, Congress is beginning to reflect America's religious makeup. There are 3 members of the House of Representatives who are Muslim out of 435. For Eunice Salim in Washington, I'm Nova Purwadi, VOA News.
France may soon join a handful of countries with laws aimed at repatriating stolen money and assets to their countries of origin. But anti-corruption watchdogs say the draft legislation needs changes to ensure the assets don't go back to corrupt leaders. Lisa Brandt reports from Paris.
It once seemed nothing could stop Théodore Obiang, the son of Equatorial Guinea's longtime president, Théodore Obiang Nguema. He has long lived the high life, funded, critics say, by his oil-rich country, where most people live in poverty. But justice is catching up to Obiang. He's faced legal action in the United States and Switzerland, forcing him to give up millions of dollars in assets. Last year, a Paris court handed Obiang a 3-year suspended sentence and a multi-million-dollar fine on charges of plundering his country's wealth to finance his opulent lifestyle here. French authorities have confiscated this mansion in the capital and other luxury goods. Equatorial Guinea is appealing the case in France's highest court. If it loses again, the property, estimated at more than $100 million, would normally go to the French treasury. But a newly passed measure in France's National Assembly could instead return the assets to poor communities in Equatorial Guinea.
It's really important to really tell our citizens and the citizens of the world in those countries, in Africa, in Asia, in Latin America, that France and other countries will not allow dictators or son of dictator to take money that is not their money, and that France will prosecute them, that France will take back this money, and that will use this money to do development cooperation.
The measure still needs approval by the French Senate. Anti-corruption groups praise the legislation, but argue the language needs to be changed to ensure the assets don't end up back in the hands of corrupt leaders.
It's basically saying that the confiscated assets should be returned at the closest possible to the population that has been deprived. So we believe this wording to not be precise enough. Accountability and transparency, this is absent from the law at this point.
The Obiang trial started with legal proceedings filed by Sherpa and fellow anti-corruption group Transparency International that also targeted the leaders of Gabon and the Republic of Congo. Some from Equatorial Guinea are following the events closely.
This is a family that for 40 years, for 4 decades, have ruled a country as if it was their own private fiefdom, without any accountability. So the fact that the French have gone as far as taking this case to the Supreme Court, it's very meaningful.
Alicante hopes a final French conviction of Obiang and a new ill-gotten gains law will warn other corrupt leaders from poor countries they could pay heavily for stealing from their people. Lisa Bryant for VOA News, Paris.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, we wish you a great weekend.